Welcome to week 8, mini lecture 4. This is the final lecture episode in our 2-week series on the spine and pelvis. In this particular episode, we will highlight some syndromes and conditions that relate to the spine and pelvis and how rehabilitation may be possible. And with that being said, we will get started. So, the first syndrome that we're going to discuss is generally referred to as muscle imbalance syndromes. And this is really characterized by the tightness of a muscle group alongside the weakness of its antagonist muscle. As a result, there may be compensation or compensatory muscle firing patterns that exist within the adjacent segments. Typical symptoms include pain and also a reduction in function, and myofascial tissue may have certain changes in structural adaptations that may present as well. So I'm going to give a couple of examples. So the first one is hip flexor tightness, and then we will move on to piriformis syndrome. Now, hip flexor tightness tends to be common in patients who exhibit excessive lumbar lordosis. In this case, the tightness of a muscle group refers to the hip flexors being tight and restricted, and the weakness of its antagonistic muscle would refer to the hip extensors as they are weak and inhibited. This muscle imbalance syndrome is characterized by an exaggerated anterior pelvic tilt with lumbar lordosis while standing. As a result, rehabilitation may include uh, trying to correct the shortened muscles associated with hip flexor restriction, as well as myofascial release of the restricted soft tissue, as well as trying to correct for posture and strengthening of those weak antagonistic hip extensor muscles. When the hip extensor muscles are weak, it is once again secondary to the muscle tightening of the hip flexors, and therefore lengthening of those hip flexors will have a significant positive impact on strength changes in the hip extensors. To correct for posture, neuromotor control exercises, pelvic stabilization activities, and strengthening of the lower abdominals for pelvic support will all aid to achieve good posture. The next syndrome, which is another example of muscle imbalance syndromes, would refer to the piriformis. Once again, hip flexor restriction requires the correction of shortened muscles, myofascial release of soft tissue, and correcting for posture as well. And in this case, once again, it is the piriformis that is tight. So stretching exercises may be indicated, and strengthening exercises may be indicated for the weak antagonistic muscles. This may include strengthening exercises for the hip abductors and medial rotators. Piriformis syndrome is a self-limiting condition such that pain associated with this muscle imbalance may actually dictate a patient's ability to perform exercise. So those are a couple of examples of muscle imbalance syndromes. Now we're going to move on to a couple other conditions, bursitis and tendinopathies. Bursitis refers to that inflammation of the bursa, And the most common site for bursitis in the hip is the greater trochanteric bursitis. But once again, other bursa that surround the hip may also be subject to irritation. Differential diagnosis should be considered as there are a number of other syndromes or conditions that may cause pain or um, inflammation in this area. For example, one must rule out lumbar disc injury, fractures, nerve entrapments, inguinal hernias, uh, other hip joint type diseases, and bone tumors. I'm going to describe once again two examples of bursitis in the hip region. So the first one being the most common, greater trochanteric bursitis, and then the second one, iliopectineal bursitis as well. So firstly, the greater trochanteric bursa is susceptible to bursitis, particularly among runners. So when a patient's running mechanics increase stress on the bursa, and this may be second to a greater than normal adduction angle or running on certain surfaces. Individuals can also have a muscle imbalance between the adductors and abductors. They may also have a leg or limb length discrepancy and also a wider pelvis. These may also be underlying causes for bursitis in this region. Pain in the lateral hip can radiate distally down the thigh or proximally into the lateral buttock. There is also pain involved when lying on the involved side and crossing the legs, as well as during activities like walking and running. Next, iliopectineal bursitis refers to the pain exhibited in the region where the iliopectineal bursa exists. And so essentially, the structure lies superficial to the anterior acetabulum and deep to the iliopsoas tendon. Activities that can aggravate the bursa include sudden flexion extension type activities like resisted motions. So if we think about, for example, individuals who perform certain skating type exercises like in hockey, um, this may be common. And notably, the bursa lies adjacent to the femoral nerve and therefore may irritate the nerve if the bursa becomes painful and swollen. The pain can also radiate into the hip, anterior thigh, or knee if the femoral nerve is affected. Next, moving on to tendinopathies. There may be a number of factors that are associated with tendinopathy type injuries. This may include muscle tightness, imbalances, limb length discrepancies, running on certain surfaces, or incorrect mechanics. First and foremost, one must establish the underlying cause to correct and minimize reoccurrence. Stretching exercises and a graduated program of primarily eccentric strengthening exercises may be used. Soon after treatment begins, and other exercises such as balance exercises and core can also be incorporated. Common sites for tendinopathies include the adductor longus, the iliopsoas, and the rectus femoris tendons. Next, moving on to fractures and dislocation. So this will be the final slide of this week's lecture. Stress fractures, as you know, are very common in athletes. There are also traumatic type fractures, which are relatively rare in athletics, but may be more common in the workplace because of the great forces that may be required. Stress fractures, though, as I mentioned, common in athletics. and growth plate fractures occur in young athletes whose epiphyseal plates remain immature. So, speaking about fractures and dislocation, as you know, bone is constantly undergoing remodeling with the osteoclasts and osteoblasts, and in response to the stresses applied to it. Stress fractures will occur in patients, particularly when a training program occurs and progresses quite quickly. So, if you think about an individual who may be training for an athletic event, if they increase their training program too quickly, particularly in terms of training intensity, this may add too much stress and the bones remodeling process can simply not handle that. Uh, Stress fractures can be commonly seen in distance runners and other athletes whose sport really involves a high volume of running. Stress fractures can occur at the site of the pubic ramus, the femoral neck, and the subtrochanteric region of the femur as well. Symptoms include a very sharp, deep, and localized pain. It is aggravated by jumping and running. Notably, it can be sometimes difficult to diagnose at first because in the early stages, rest relieves the pain. But if the injury progresses, then the pain will actually continue despite rest. Rehabilitation obviously needs to focus on correcting any of the underlying factors, needs to have restrictions or contraindications against performing weight-bearing type exercises for a number of weeks. So up to 3 weeks or a month would be appropriate. Exercises such as non-weight bearing exercises or deep water running, as an example, may occur earlier in the program when weight bearing type restrictions are present. Additional exercises for the hip, knee, ankle, and trunk can be included as the patient progresses back to full weight-bearing type exercises with a normal gait and without pain. They may perform progressive closed kinetic chain and proprioception exercises to make additional strength, balance, coordination, and agility gains. Lastly, I'll speak to dislocation. And we mentioned, sorry, I shouldn't say, we mentioned briefly about growth plate fractions. These are common in young athletes, once again, related to the immaturity of the epiphyseal plate. But I will skip forward to dislocation. And this is relatively uncommon in sports. If we think about the hip socket is deep. There are a number of surrounding soft tissues and ligaments that make it a very strong region. If you think about the hip relative to the upper extremity with the shoulder, once again, the ball and socket joint is different. Once again, much deeper. It cradles the head of the femur and once again will prevent dislocation. For a dislocation of the hip to occur, a large violent type force would be required. So it may be possible in very high energy type sports where there's external force applications. So examples might be in downhill skiing or in soccer or football or rugby. Hip dislocations, though, are also considered to be emergencies because of the risk to arterial damage. And therefore should be treated immediately. And that concludes this lecture episode.